Namaskar, ma'am.
Namaskar, namaskar.
How are you
Can you
doing?
see me?
Yes,
I'm
yes, we can
fine.
see. How's your eyes?
Okay.
How's your health?
My eyes are shocked with some light around because after inserting the new lens, the eyesight improves a lot. So definitely, yes.
So, ma'am, before speaking about anything about this conversation, first of all, thank you so much. And this entire conversation came into my conscious to have and hold this conversation with you because I remember one episode with you when you came back from Boston. You called me up and you said that Shivani, so far it seems everything is healthy and good because you stressed on the movement, mobility. You said that you had your room in on first floor or second floor and you had to take the stairs all the time, which is first green check. Then you had to pick your granddaughter in the arms every time, which is again second green check. The third, you said that in the evening you have to prepare some nice meals for your son because you are meeting him after a lot of time. And as a mother-son, relationship, mother-child relationship, you want to shower love with him, with his fondness, right? So you had to stand in the kitchen, do different errands and different jobs altogether. Again, third green check where you can handle all your jobs. So, ma'am, you have been now coming to the main point, main discussion of this IG life. You have been working with patients for decades through your medical yoga and therapeutic yoga. Agnosis Medical Yoga Foundation, where you see people across different ages come to you who are struggling with spine issues, posture problems, mobile restrictions, and age related degeneration. So, now if we are speaking about age related degeneration, let's highlight spine degeneration. Do you think today's modern lifestyle is accelerating this spinal degeneration?
Yes. So before we go directly into the degeneration, let us briefly understand what is spine. What we say spine, it's a beautiful bony column called vertebral column. And everybody knows that it consists of multiple vertebrae, 7 being in the neck, 12 being in the back, 5 in lumbar, 5 sacral fused and 4 coccygeal, that is tailbone. And all these vertebrae are nicely connected with each other with a 3-joint complex. And when we say 3-joint complex, there is something in between, in the center, in between the bodies, and that is the soft part, which is called intervertebral disc. Because why it is soft part? Because it is not bony, right? So it is an intervertebral disc and 2 joints on either side. And this disc is not taken care of by us, and it is noticed or it is given importance only when it slips. When we slip a step and then we know, oh my god, my ankle is having a sprain. Similarly, when this disc slips, then we are suddenly admitted in the hospital for the sciatica. So otherwise, we don't pay any attention to this vertebral column, a beautiful column, bony column with soft tissue called intervertebral disc. Now, why nature has given us such a beautiful column? Everybody knows for protection of spinal cord which travels through it. Spinal nerves come out through the adjacent hole or the foramen. So for the passage, definitely for the movements, had it not been the joints, had it not been the disc, our movements would have been very restricted like a bamboo spine, which is a pathological condition. And of course the shock absorption. We jump, we do so much high impact movements, all the impact is absorbed by the intervertebral disc, the ligaments, the muscles and everything. And of course, providing the passage as I said. Now if we understand, and weight bearing, I forgot one function is the weight bearing. What is this weight bearing function? The weight of the head is borne by these tiny 7 vertebrae. Weight of my head and 2 arms is borne by my thoracic vertebrae, which has a rib cage. And weight of hat, we say hat is head, arms and trunk, is borne by my lumbar vertebrae. So maximum weight is borne by my lumbar vertebrae and that's why lumbar spine suffers. With this kind of knowledge, that what are the functions? Out of all various functions, main is the weight bearing function. And whenever there is weight bearing, there is degeneration. Why? Because whenever there is weight bearing, there is wear and tear. Same thing happens in the knee joint. So fundamentally, we should understand that the whole vertebral column is a weight-bearing structure at joints and the disc. And if we don't take care of this vertebral column for its joint function and disc function, definitely it is going to degenerate in a very fast way. And that's why, as you have noticed, it is observed even in youth, that is in between 25 to 35 age onwards, which was predominantly as a degenerative complaint was of elderly people, like when I started my practice 45 years ago, but now we are seeing the patients of all ages, right? So this is what is degeneration, this is what is aging of the spine, which can be nicely prevented, nicely delayed. That is the language which we should speak.
So, this is nice that you have mentioned here that it can be nicely delayed, nicely prevented. But let's go back again to the root cause. So, what do you think? Some of the most common daily practices, and here I'm including all like the age group from 20 to 45 to 50. Because post then we'll speak about the degeneration, but before that, let's speak about the active years. And what are the root cause, or what do you think some of the common daily habits that can lead to degeneration of the spine?
The degeneration, that is what is called spondylosis. Spondylosis by definition is degeneration of intervertebral disc and intervertebral joints, right? So this spondylosis, which is very common in cervical, that is neck region, and lumbar, that is low back region, was observed after the age of 60, as I said, when I started my practice, and now we are seeing the same complaint in the younger age group. Now why? Everybody knows prolonged hours of working, less sleep, no exercise, no peace of mind, faulty nutrition. So we are using and only using our body, mainly the spine, without doing any servicing or without any paying attention. Forget care, not paying attention also. That's the reason why people are suffering. The young candidates from IT software and all over the world, they are suffering from cervical spondylosis or lumbar spondylosis, because this cervical spine is a very tiny column, very tiny, very delicate small vertebrae. They are bearing the weight of the head. Now my head is fixed on the screen. For how many hours? 7 hours, 8 hours, 10 hours, 12 hours, the head is fixed. Now my head is fixed because of the fixation of the not only cervical spine but my shoulder joints, my scapula, my rib cage. So people have to understand not only cervical spine but the whole shoulder girdle. And if you attend the shoulder girdle properly, it's a girdle, it's a circular structure. Something in front, something at side, something behind, then definitely cervical spondylosis can be prevented. You
Ma'am,
don't have to, yes.
please continue.
You don't have to wear collar, you don't have to take medicines, you don't have to be absent from your work. You are not supposed to suffer because everybody is working for more hours. 8 hours have gone, 10 hours have gone, now everybody is working for 12 hours. So can body work for 12 hours? I will say yes, we can work for 12 hours, not 14, 16 hours also, provided we take care of this whole shoulder girdle, the muscular structure, nutritious food, and of course, peace of mind and rest to the spine. Rest to the spine, Shivani, is very important.
But ma'am, here you have put two things. First, you are saying that yes, we can work for 10 to 12 hours. And the secondary statement is that we have to take care of the rest of the spine. How these two things can go hand in hand?
Supposingly, you are working for 10 hours, you are working, 2 hours you are spending in traveling. You come back home. You have your meal at home, chit chat half an hour with your family, and immediately go to sleep at 10 o'clock or 11 o'clock and get up at 6 o'clock or 7 o'clock. So 7 to 8 hours of sleep is mandatory. But what happens after taking dinner and children are already gone, said bye bye to good night to daddy. Now daddy watches the TV. The Netflix is on, and we get so much entangled in that so-called entertainment, and we are sitting. Either we are sitting and observing the TV or lying down with what kind of Headrest and neckrest, God only knows. But there again, that spine is jeopardized. Maybe the entertainment is to mind, but it is definitely not to the eyes and definitely not to the spine. So we have to reserve that entertainment time only on Saturday, Sunday, but 10 o'clock or 11 o'clock we have to go to sleep. And that rule is for me also. Last 2-3 days I am watching one serial in which I got entangled and I said that no, this is wrong, Vinita, and from today onwards I am going to stop at 10:30, 11 o'clock I will sleep. So spine rest is very important. And when spine gets rest, spine gets rest only when you lie down in bed because the gravitational force which works on spine, now it is not working. Weight bearing is maximum during sitting and standing because of the gravitational force. The moment you lie down, the gravitational force has gone down and the spine will say thank you. That
So
you have to understand. Yes.
So, ma'am, let us summarize this thing that the two most dangerous activities that can have the biggest impact on spine health, degeneration of spine health, can be standing and sitting for a longer duration of time.
Yes. Yes.
And if we give small breaks in between, or
Yes.
we can give a good amount of rest to the spine, which is lying down, lying straight on the bed, because that's against the gravity, right?
Right.
Then it can
So
help in regenerating the spine or it can help in taking care of the spine. What do you say?
it will help in delaying the degeneration of the spine. Now lying down is not possible for everybody. I do understand that. For those who are, it is possible, they have to take at least half an hour, not beauty sleep, let us call it spine sleep. Okay, let the spine get rest. But for those it is not possible. At least every half an hour, you have to stand for 10 minutes. Every 1 hour, you have to sit for 15 minutes. Every 1 hour of prolonged standing, you have to stand for 10 minutes. And that kind of table arrangement is done at IT sector and software companies. That the whole table comes up, they stand and continue the work, and then again after 1 hour, maybe the alarm is set in their watch, and again the table goes down. So like tobacco chewing is injurious to health, prolonged sitting is also injurious to health. जैसे हम कहते हैं दिन भर बैठे तो होते हैं थकने को क्या होता है but that is not true. Prolonged sitting is injurious to our spine, so I have to stand in between, walk in between, and then again sit. Yes.
So, friends, Dr. Ketkar is saying sitting is the new smoking. So, make sure you don't get addicted to it.
Yes, correct, correct.
So, I always say that spine is a beautiful highway between brain and body. What do you think spine health can influence how we age physically and mentally? Can
Yes.
spine health influence our mental health and physical health?
Yes, correct. So before I will go for the answer of this question, let me mention in addition to shoulder girdle, pelvic girdle. Like we are taking care of shoulder girdle to attend our cervical spine, we have to attend pelvic girdle to understand our lumbar spine. And that pelvic girdle is again something in front, something at side and something behind. So it is in medical language, it is the flexors in front, extensors behind, and the hip joint at the side. Everything you have to take care so that the lumbar spine is helped. That is what is the message to the society that it is not only the spine on which you are supposed to work, you have to work on the whole girdle. That's the part.
So, ma'am, you
Okay.
were talking about two areas. Let's go back to that question itself. You were talking about the two areas. The first area is pectoral girdle, and the second is pelvis girdle. And by pectoral
Yes.
girdle, you want to say the shoulder area, the
Yes.
entire 180 degree around the shoulder area, and then 180
Correct.
degree around the waist area, right?
Perfect, perfect, perfect. And now that itself will answer your question. What is the correlation of spine health with mental health? The correlation of spine health with mental health in between cervical and lumbar is the thoracic region, the back region. And have you heard of thoracic spondylosis anytime? The answer
Yes.
will be no. No. Thoracic spondylosis does not exist because the thoracic
Cervical
spine is
spondylosis
supported
is
by the
there.
rib cage. Because of the rib cage. Right? So nature is very kind enough to give rib cage to the thoracic spine. So thoracic spine never suffers. But now this thoracic spine is connected up to cervical spine and below to lumbar spine, right? So if you are very careful about your neck region, that is shoulder girdle, it is going to attend a thoracic rib cage also. And what is in the rib cage is our heart and our lungs. So when you are aware of your shoulder girdle, when you are aware of your pelvic girdle, automatically you will breathe better. And if you breathe better, you will have immense mental peace. Mental peace is dependent definitely on the sensory inputs, but what is in our hands is breathing. And that breathing will be definitely better when you are aware of your shoulder girdle and pelvic girdle, but more of shoulder girdle, right? And that's why the postural awareness has gained so much of importance. The postural awareness is not only to look smart and handsome and beautiful, but also to breathe better. And you breathe better, you are confident, you are peaceful, you are in a way when you attend your shoulder girdle, our main instruction is raise your rib cage up, widen your shoulders nicely, gently push them back and relax them. So with these four instructions, the person automatically pays attention to the breathing and the mind becomes quiet. So in the body Shivani, everything is connected. And spine and spirituality, spine and mind, spine and psychology, emotional status, everything is linked. Like we doctors, we first advise X-ray, is normal, MRI, normal, everything is normal. But still the patient is complaining of persistent or recurrent neck pain or low back pain. Then we say it is psychosomatic. Ultimately, after ruling out all the causes, nothing is wrong anywhere, then something is wrong at mind, and then we claim it, and then we prescribe either tryptomer or some anxiolytic medicine. Why? Because the whole spine, as you can see here, the whole spine is supported by a very big muscle, which is called erector spinae, which keeps the spine erect. And that muscle at subconscious level goes in a state of spasm, making us tired, and that gives rise to pain because these muscles play at subconscious level. If you are not feeling well at mind, muscles respond in a different way, and then because the muscles are over contracted, they feel fatigue, and the person also feels tired, and then the aches and pains start. So that is the link between skeleton, muscles, mind, breathing, and in a way yogic approach attends everything. And एक के ऊपर एक नहीं, एक के ऊपर हम बहुत सारा फ्री में देते हैं.
So, friends, if you are watching this IG live and you'll be watching later on, I would like to tell you that what ma'am has spoken about erector spine and all these muscles, the key important muscles that hold our spine. She's also talking about these things in her geriatric care lectures, where in module 1, she's taking care of aging physiology. So, if you are interested to understand more about it, you can always sign up for this program. This program is starting from 23rd May onwards. So, ma'am, going back to our question, now, here you are talking about postural awareness, which is more like a body awareness. A yoga therapist is very well aware about it. Yoga instructors are aware about it. People who are practicing yoga quite some time, they are aware about it. But the common masses, I am separating these common masses separately because they are not aware about it. They just know, in slanting way they want to sit or they want to stand, putting pressure on one of their leg. Those are the lifestyle checks which they don't know about it. So if you want to suggest spinal care should be started at a point of time, what will be the correct age or what will be the correct time you will suggest to start taking care of your spine?
The ideal age will be at the age of around at the age of 35 because after 35 we say the physiology says the regeneration is equal to degeneration because degeneration is occurring right from the first day of our life. Cells become old, they are removed, the usable ingredients are utilized, unusable ingredients are thrown out. So this process starts right from first day. But the degeneration is equal to regeneration up to the age of 35. and after 35 this graph becomes something different. The degeneration continues, but regeneration takes a backseat, and that's why the degenerative conditions occur in our body. So at the age of 35, I think one should celebrate the 35th birthday, but start taking care of servicing in the form of servicing of joints, mainly the knee joint and the spine, and of course various physiological functions. 35 onwards, and that approach should be educational. Like, how am I going to take care of my spine? Which muscles are supporting my spine? Which muscles need stretching? Which muscles need strengthening? Which muscles are responsible for balancing? Because as age advances, like usually I get at least one or two couples a week where either wife says that my husband is not looking smart, look at his posture, he's all slumped up, or the husband says, look at my wife, she was so beautiful, bold and confident, how she is carrying her body, I'm not very happy about it. So this kind of couple is always meeting us, and then we tie this rope and belt passive correction for shoulder girdle correction as well as pelvic girdle correction. So as to make them understand, see what's happening now, where you are feeling the stretch, how the posture is maintained by which muscles. So these muscles should be strong so that you will sit straight with awareness, but simple awareness is of no value if the muscles don't have strength. So there has to be a proper geriatric program where these people are supposed to understand, now I am strengthening this muscle, this part of this muscle, and that is why my shoulders are very much broad and nicely pulled back because I am working on those muscles. Right? So it should be started at the age of 35, but it is never too late to mend. At any age you can start and then continue, and it doesn't take much time. 30 minutes will be sufficient. Just now before joining your IG, I just did my 50 minutes workout. That is what is the strengthening program. Starting with 10 counts, then 25 counts, then 50 counts, then set of 50, something like that. And then you feel your muscles are strong. Day before yesterday, one patient asked me, do muscles degenerate, Shivani? And it was an eye opener to me. I answered, no, muscles don't degenerate. Muscles don't degenerate. You work on muscles, they become strong. You don't work on muscles, they become small. Atrophy and hypertrophy, right? So very important message that patient gave me actually by questioning me, muscles don't degenerate. So we have to work on muscles, otherwise we will lose them. Use them or lose them. Yes.
I still remember when we were shooting you for the geriatric care program, you used to have a break for 30 minutes or 15 minutes, and you used to start doing your some routine set of exercises because you were
Yes.
sitting there for quite some time. You said that
Right.
how important it is for you to
Yes.
stretch and strengthen. So it
Correct.
goes, and not only that, in your geriatric program, you have mentioned about this muscles while you were explaining the sarcopenia concept. At that point
Correct.
of time, you have mentioned about how the atrophy happens and how the um,
Correct.
now let's go back to the senior citizen. Now, since you have spoken about so much about the senior citizens' health, ma'am, falling is so frequently seen in senior citizens. They tend to fall easily because of imbalances or balance postural problems. Do you think that spine health and the prevention of falling is suitable, is somewhere connected?
Yes, definitely. Because as you rightly said, balancing requires lot many functions, right from the touch sensation, proprioception, the muscle strength, then visual input, so many things. But out of that, balancing on one leg becomes very tricky as age advances. So many people sit and wear their clothes up many times, and that is a good practice. However, balancing on one leg, because while walking also for a moment we are on one leg. People forget, but while walking for a moment we are on one leg, right? So simple walking and not losing the balance, for that we have to work on certain muscles. And why this falling becomes dangerous or troublesome or the deterioration of the health is because of osteoporosis. Now so far we were constantly talking about muscles, 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 but since our topic is spine, the spine is made up of, as you can see here, spine is made up of the vertebral bodies. The bodies are in front, and these bodies are the column which bears the weight, and they are having a specific density, bone mineral density or bone mass density, and this density goes on reducing. This is not degeneration, this is decrease in the density of the bone mass as such. As the age advances, more common in females because of lack of estrogen in postmenopausal status. That way the female, the testosterone levels continue, and that's why they don't suffer much from osteoporosis, more so common in case of females. Now, because of lack of estrogen, if the density of the bone is less, the bone becomes porous, hence it is called osteoporosis, and then the fall leads to fracture of the body of the vertebra, which is very common at either T12 or L1 level. The junction is known where the weight is transmitted from thoracic spine to lumbar spine. So susceptibility of having fracture, this is called compression fracture of vertebral column, at particular level is very common, and as everybody knows, fracture neck femur and fracture lower end of wrist, that is also very common. It is because of osteoporosis. Now if you are aging, slowly age is increasing, but you want your muscle mass good, you want your bone density good, the only way to do that is work on your muscles. You have to do exercise because luckily the body responds. The bone forming cells, osteoblasts, respond to your exercise, and bone density can be maintained with the help of your exercise regime or yogic protocol regime. So, maintaining the bone density and muscle mass to prevent falls leading to fractures definitely can be prevented.
Ma'am, so you have spoken about how therapeutic yoga can be in preventing this thing. But imagine there's somebody who's into another kind of fitness, like going to the gym or doing some laborious fitness activities or heavy, extreme, aggressive fitness activities. How you will describe, how, what will be the do's and don'ts which you can suggest to that particular segment while aging and still taking care of your spine health?
See, whatever rigorous activity you are engaged in, as age advances, you have to optimize them, right? People tell me that I used to do 50 Surya Namaskar and 100 Surya Namaskar when I was around 35, 45. Now you are not supposed to do 50 and 100 Surya Namaskar definitely. Or climbing Parvati. Parvati is a very famous hill in Pune. 3, 4 times a day. So as age advances, first of all, Shivani, you have to optimize the activity so that the activity will be continued till the last day of your life. Now, many senior Rotarians come to me to play golf. I think I have discussed this in my lectures. Playing golf in the morning, having breakfast with their friends, is a happy morning for them. So the Rotarians who have crossed 80 come to me only to request me keep my knees fit. I don't want to stop my golf. Now this is what Shivani I call it a functional fitness. If the life continues without pursuing the passion, what is the big point in living? So what we geriatric caregiver people should offer is a functional fitness to the people. Don't do this and don't do that. What is the big point in them just continuing the life? So coming back, we can definitely offer functional fitness. For that, the middle-aged people should understand aging is very natural. Let us respect it. Let us optimize the work. Take the help. Whatever help is around, just don't be adamant in saying, no, no, I don't want help. No, take help. You do something better which others can't do. So optimize, navigate your work pattern, and then keep yourself fit. That is what is the message to the geriatric people. So they don't have to stop and sit at home. Not at all. Right.
No, I still remember while you were explaining to the geriatric care yoga therapist about how this fall or the right sequence or the correct functional fitness need to be given to the senior citizen. I still remember evidently that you have mentioned about the rope and belt therapy for the pelvic area, that
Yes.
how that balancing, how that alignment so much matters to them. Especially
Yes.
in taking care of their osteoporosis, you again show the knee arrangement, the knee
Yes.
rope and belt arrangement. So I still remember that how you have picked some kind of not intensively, but some kind of functional fitness from rope and belt therapy itself that can always come handy and easy for the senior citizens to
Yes.
delay this kind of degeneration.
Yes. Yes.
So, going back to one question, ma'am. I know you will say yes, but still, can yoga support spinal longevity and healthier aging?
100%. 100% yogic science will offer the spinal fitness, spinal functional fitness, and of course, not only at physical level but at emotional level also, because it gives, see, any kind of confidence and confident gesture gives you emotional fitness. The moment you lose confidence, your emotional level is disturbed.
Absolutely.
Yeah. So my mother, I always end my lecture with my mother's memory. My mother at the age of 90, she makes it a point at 5:30. Now because of bright sun 5:30, she goes on the road, crosses the road, then greets the vendors, whoever are near her home. Just say hello, whether she buys or not, it doesn't matter. But she comes out of home, crosses the road, meets all these vendors, buys something. That maintains her confidence, and that confidence gives her the satisfaction and emotional health. If she says that so much of traffic is there, even her gold chain was snatched once. But she said, okay, I just donated to that snatcher. I mean, she was not at all bothered about that, but it never put any hindrance. So, basically, not restricting your movements, but maintaining the basic movements will definitely maintain not only the physical health, but the mental health as well. So, all geriatric people should be as active as possible till last day of their life. Don't let us not
Absolutely.
depend on anybody. We have to depend only on our efforts. And that is what is the success mantra.
No,
Yes.
very, very true, ma'am. And I think the quality of movement gives them the confidence, and this quality of movement comes from the quality of spine. So we can
Correct.
always say that quality of spine is equal to how gracefully you are aging.
Yes. And
So,
to end the lecture, the spine is weight bearing, and this weight bearing is going to hip joints 50%, 50% via SI joint, and then that 50% is borne by knee joint, ankle joint, and feet. The spine actually, if it distributes the weight exactly 50-50, the weight bearing axis will be automatically nicely maintained. So spine is the carrier, weight bearing carrier, and then transmitting also right way. And that's why maintaining spine health is very important.
absolutely, it is very crucial. Before you leave this IG life, I have last question. Many younger generations say things that degenerating of spine is related to only old age. And here I'm not talking about the younger generation like millennials like us, but I'm talking about Gen Zs. They think that the spine degeneration is limited to old age people. Now, what do you think that can spine degeneration can happen to young people also? If yes, what will be one mantra which you will give it to them to take care and sustain the health of spine?
I will give a word of caution to Gen Z saying that let say that degenerative changes only occur at an old age. As I said, it starts right from the day of the birth. So they have to be careful because they have to pursue very adventurous life. They want to go for monkey jumping, they want to go for trekking, they want to go for many adventure sports and which are coming like anything. For that matter, that paragliding and parachuting and whatnot. And if they want to enjoy their life to the fullest extent, they have to take care of spine. Shivani, in my yoga center, out of 6 to 7 senior people, at least 2 people are young. At present, one girl called Shiva Kanti, her age is 28. She is suffering from severe sciatica and she is also lying down on that bench and she feels very bad. But all around are the old people and I am only the young girl sleeping here. But that happens. That happens. So once in a while we do get, not once in a while, one or two patients are always in the crowd, and that gives me an indication that this kind of degeneration can occur in young people because of various reasons. So they should not take that spine for granted. It is better you attend your spine and enjoy your life.
Absolutely, ma'am. The enjoyment of life, friends, doesn't come from spending money in expensive serums and creams and anti-aging routine. Why don't you hire a good yoga therapist and practice yoga with that person? I'm
Yes.
sure this investment will go for a longer run and will give you happiness throughout your life. What say, ma'am?
Perfect. Yes, yes. I will end my talk with a memory of Iyengar Guruji. Iyengar Guruji once while conducting our batch, he kept us in Uttanasana for almost 10 minutes. We were about to faint. For 10 minutes and we were just waiting, come up, come up, come up, he will say. But he said it after 10 minutes. And when we came up, he said, go and look at your faces. I have given you free facial today.
So a good then I'll conclude it by saying that the creams, the expensive creams will not give you a spinal care, but a spinal care can give you a good facial.
Perfect. Facial care. Perfect. Perfect. Yes.
Okay, ma'am. Thank you so much, ma'am, for joining us. And
Thank
to
you.
all the students who have joined this IG Live and who will be watching later on, if you are interested, 23rd May onwards, our batch 4 for geriatric yoga teacher training course is starting. We'll be more than happy to have you on board. If you have any questions prior to joining, please do get back to us. We'll be more than happy to answer it. Namaskar, everyone.
Thank
Namaskar, ma'am.
you. Thank you. Thank you. Thank you.